Welcome to Rev Up Your Business with Hilda Gann. We are now in season 5, and we've changed the name and the focus of the podcast. Rev Up Your Business is the podcast for small to medium-sized business owners, entrepreneurs, and HR professionals. Each week, we share tips, strategies, and trends on how you can build success in your business. I share my expertise as a people-centric leader in work culture and human resources. My guests share their expertise in human resources, marketing, sales, finance, IT, leadership, and the multiple facets that you need to take care of your business. If you love to learn and want to find out how you can rev up your business, join us. Welcome to another episode of Rev Up Your Business. Today, we're putting the focus on mental health, and my guest is Amy Stein. For those of you who don't know, Amy Stein is part of Henry's Camera, a business that was in its 4th generation when they sold it recently in June of 2023. Amy is a purpose-driven social impact and retail executive. She's very proud to be the executive director of the Pixel Foundation, formerly known as Henry's Foundation. And the purpose of that was to envision a Canada where creative expression in all of its forms is recognized as an effective way to promote, support, and improve mental health. With over 20 years of corporate experience across all areas of business, Amy loves the challenge of building something from nothing. She's passionate about defining a strategy and creating the infrastructure to execute on it. And she has the natural ability to get a team working together towards the same goal. Above all, she's driven by the opportunity to use her corporate skills to make a social impact that really matters. While the Pixel Foundation launched just before the pandemic, Amy stayed the course and positioned the foundation's reputation as a strong voice in the mental health community in just the 3 short years that have happened so far. Throughout her career, Amy has been a vital part of Henry, Canada's greatest camera store, and I can attest to that. I've bought many cameras through the generations. This business started in 1909 with her great-grandfather in it, and is in its 4th generation. It became the largest digital imaging retailer in Canada. And Amy knows, from working at the sales counter alongside her grandmother as a little girl, Amy went on to work in nearly every part of the business, from merchandising to marketing to purchasing to logistics to sales. And she sat on the board of directors of both the Henry's Company and its foundations. I'd like to now focus on talking to Amy about mental health. Welcome, Amy.
Thank you so much for having me.
Amazing, amazing career. That you are purpose-driven. You make things happen. So tell us a little bit more about this mental health focus that is important to you and your family.
Sure. So I guess the first piece actually is as a family, and the business, we always did donations and sponsorships. But we did them because there was a personal connection to them. But there wasn't, I would say, a strategy around that. And to really make an impact, we needed to pick our lane. What did we want to focus on? Because we can only pick one if we want to have an impact and to really make an impact in a cause. So we decided as a family, for us, that was mental health. Really, because mental health to my family it's a personal connection. We know that it resonates with our employees and the community as well. And this was actually before COVID. So I was on the corporate side for 20 years, and I transferred to what was to become the foundation in April 2019. The foundation didn't exist. And really for us, that strategy was mental health. My grandfather died by suicide in 1977. We believe that if he was diagnosed today, that he would have been diagnosed with bipolar disorder. My father has it, and my sister as well. And she came out as the first CEO in Canada to say that she lives with bipolar disorder. And it's not a friend, it's not a family member, it was her. And to show that, your mental illness does not define who you are. and what you will do later in life. And so really that was sort of the premise for us, was why we were supporting mental health and why we chose that.
Thank you for sharing that, because that sometimes people want to hide things that aren't
Mhm.
in the norm. And
Yeah.
for you to share about your grandfather, and then to share about your father and your sister to share, I'm a CEO and I have bipolar, but look, I can do this. I can make it happen.
Mhm.
That's the kind of courage. And it shouldn't be courage. It should be just normal comfort that we can all say that some of us have challenges, whether it's in mental health or whatever. So thank you for sharing that. Um, was
You're
it
welcome.
difficult for that to happen? It must be easier now, but the first few times, did you have to deliberate whether this was something you could and would share?
Yes, absolutely. We had a big conversation around this. It definitely was not a quick conversation, and it happened over a few years.
Yeah,
So
yeah.
we had this conversation before COVID. It was probably a couple of years before COVID, and we decided it wasn't the right time then.
Hmm.
A few years, uh, my sister released her story in December of 2021, but we decided that we were going to share our story, because if we're asking people to share their stories, we need to set the example and share ours. And that was really the premise of what the foundation was all about. And it was about storytelling. And how do you share your story so that there's a beneficial outcome? You're not just sharing a story for the sake of sharing a story. It's to make sure that people know that they are not alone, and to really eliminate the stigma. Because if you're talking about your mental health, you'll get help when you need it. If you're not talking, you're not getting help. So our goal really is really to be able to share stories and provide a platform for people to be able to do that.
How do you help people respond to the stories? Because I think sometimes people don't know what to say when, or even to ask if they suspect something is happening and they want to help. They know this person may be stressed so much and they want to help, but they don't know what to say. And when the person says something, how to react. What kind of advice would you give people?
The advice that I would give, and I'll sort of premise it by saying, one, I'm not a medical doctor. I'm running a foundation in mental health, but I think I've listened to enough researchers and people with the right credentials to be able to say this. Um, but in my opinion, I would say that every conversation is a good conversation. By not talking about it, it does actually make it worse. People think by talking about it that they will say something wrong, and that will make it worse. It actually does quite the opposite. Um, People want to know that if you've got a friend that you think is struggling and you want to have that conversation, they are difficult conversations to have, and you want to be prepared as much as you can. So there are language guides available. We have a copy of the Bell Let's Talk guide, and that will give you the language to be able to have the conversation. And there's some great examples in there. The guide is on our website, so it's pixelfoundation.org, and it's under the resources section and get help. So the one thing I would say is that you don't want to try and fix the person. You can't fix it, but you can let them know that you are there and that you're supporting them.
That's such good advice.
Yeah.
Yeah, you're not there to give advice of how to fix it. You're there to listen and to
Mhm.
say that you're there if they need you in whatever capacity. That's
Yes.
great advice.
Yeah.
That's great advice. Can you tell us a little bit more about the foundation, or any um, trends or best practices that you know in terms of helping people build the ability to talk about mental health? And I'm talking now and asking employers and managers and leaders in HR to think about, how do you help foster it's okay to talk about mental health challenges?
Yeah. So I would say that, among all the many trends about talking about mental health, and I think, if there was anything good that came out of COVID, it was the ability to actually be able to talk about mental health, and that there are more people talking about it than ever before. A lot of people who did not struggle with mental health issues before were struggling during COVID. And it made people think that, it does affect all of us. And it can be anybody. It doesn't care what your postal code is, where you live, who you are, what your job is. But what I would say is for employers and businesses is that a lot of our employees and customers, they expect more from businesses today. It's not just about the EBITDA on the bottom line or what your profit is. It's really about giving your employees a work-life balance. And they think about that a lot more, I think, than they probably used to. And if the company is actually standing behind what they're saying. So they're not just paying lip service, that if we're supporting mental health, we really are supporting mental health and we're supporting our employees and we're supporting the community. Um, and I really do think that people they want to connect their work with the bigger picture and have really a positive impact on the world. So really being part of something that is bigger than themselves. And I think that's what gives people a purpose.
I know that the statistics we used to quote pre-COVID was 1 in 5. 20% of people have mental health challenges in their lifetime, right? It can be a diagnosis that is going to be there for their life, but it could be an acute episode of reactive depression, say to a death or a very difficult event. And that statistics went up. I can't remember, I think 25% at least, which means 1 in 4. I mean, I have a family of 5. So statistically, that means one of us has had a mental health challenge, right? And people don't think about that. They think everybody's fine, and they don't know these people who are walking around with a, a need to get through each day with a challenge that really has to be worked through.
Yeah, and I would say also because it's invisible. It's easy for people to hide it.
Yeah.
And because you didn't break your leg, so you can't see it. When you break your leg, you have people come over and they bring you food and everything else, and they might send flowers, but it's not the same when you have a mental illness. You're not feeling well. It's much easier to hide. And yeah, so the stat was 1 in 5 prior to the pandemic. I believe you're right. It's 1 in 4 now.
Mm-hmm.
So yes, statistically, yes, very significant. And even before the pandemic, 1 in 5, it was still about 7 million Canadians.
Yeah.
So, and it's actually that 1 in 5 is actually it's not the same 1 in 5 every year. So you could be you could be part of the stat 1 year. I could be part of the stat the next year. So it's really more people than we actually are even aware of. And that's what I would say is really sort of the driving force behind this.
You talk about strategies. I mean, you're purpose driven. You created this
Mhm.
foundation. What are some of the strategies and trends that you would suggest happen when people say, hey, you're right, we don't want to be just lip service. We want to be able to recognize our staff and help our staff. And we want to be seen as a company that it's okay. It's okay to have challenges, whether it's mental health or whatever. We want you to feel valued. We want to feel respected
Mhm.
and included. And we hear you and we're there to support you. What strategies would you share with people who want to get it right,
Yeah.
get it vocal, get it heard?
So I would say that depending on the size of your business, if you or have a big enough business that you can devote one person to this, to the mental health sector, that's ideal. That it's not a piece of their job and it's not sort of off to the side of their desk. Not every company has that luxury, but I would say that it is part of your strategic plan, and it's one of the KPIs that you measure. You measure EBITDA, you measure profit, you measure mental health, and it might be you pick those KPIs in terms of absenteeism, disability leaves, in terms of satisfaction with your employees. So you pick those KPIs, but they need to be measured because we all know that what gets measured gets done. We don't measure it, it doesn't get done.
Because it's
Um,
embarrassing when you see the stat. You got to make it. You got to make it
yes,
happen.
exactly. It's true. And I think also it's part of every department in your company really should have sort of a mental health champion there. And they're the ones that make sure that, coming from the top down, because it does have to come from the CEO, like it needs to come from the executive team, that they are supporting this and it needs to ripple down through the organization. So if you've got at least a champion in each department, they're the ones, their role really is to make sure that all of the communications, everything about mental health is getting back to the individual employee. And they're also the feedback loop. So when employees do have feedback, it comes through them as well. And you really, really need that feedback loop.
Are there any tips and strategies that you have for, managers and HR as to how do I recognize that my staff member is having problems, and what should I say? Because maybe it isn't a mental health issue. Maybe they're not getting enough sleep at night because they've got a newborn or something. Like what advice would you give to people who really want to understand and to show that they care?
Yeah, and I think in that case, it's, you need to be careful because some people will want to open up and others won't. And the important part of that, I'll say, conversation is making sure that they know that your door is open. So if they're ready to talk, that's great. And if they're not, they know that the door is open when they're ready, and that you're willing to listen. You can also start by saying, obviously, in private, saying, I've noticed that maybe you're not, you've been away or you've been late. It's out of they're out of their normal pattern.
Mm-hmm.
They're really like if they're a star employee and all of a sudden they're not showing up or they're forgetting things, like they're not they're not at 100%.
Yep.
And you can just say, I've noticed these things. I'm here to talk if you'd like to talk. And also being aware, I think, of your EAP programs, and any of the benefits that your company offers employees. Really having that, I think, in your back pocket is very much appreciated. So, and I think that will also make it easier for the manager to have that conversation.
I have communication is one of the keys that I value when I'm helping my clients really build healthy work cultures. And I have a guide to difficult conversations. And it always starts with a place of neutrality. If you're worried about what that first opening line is, you look for facts and then you share the facts. So that's what I mean by starting from a place of neutrality, which was what you did. I'm noticing A, B, and C. And sometimes I'll add, especially if it's not like them, I says, this isn't like you. Is everything okay? Or, is there anything that help me understand, and if I can, I'd like to help. Right. So you keep that channel open and you create that trusting relationship for days when you may need it even more, like when you have a tough conversation, like a mental health challenge or somebody's lost a loved one. And I think to be honest and frank, like, you're not an expert. You're not here to solve the problem. He said, I don't pretend to know what you're going through, but I just want you to know that I care. I worry about you. And if there's anything that I can do, feel free. My door is open. Just ask, because I am here and I respect your privacy, but I want you to know if and when you need me, I'm here. However, just show that you're not an expert, but you can at least be something in a way of facilitating and maybe uplifting the problem, because I'm here to advocate and support and make life easier for you at work, for example.
Yeah. And I think part of that also is if you're not feeling well, it's really difficult to advocate for yourself. So having somebody there who is willing to advocate for you, and once again, like, some people will take the help and some people won't. But being able to say, what, I'm not an expert, but here is our, EAP program, the new 988 number, the suicide
the new
top line that is
number.
open. There's professionals. There's Kids Help Phone, and they answer calls from adults as well. There's wellness together. There's lots of organizations and resources where they do have professionals.
And where
Um,
it's confidential and
yes,
you can start there if you need
yeah,
that kind of
and so
support.
you're not going to be the one to fix them. You don't want to be, but you can
Mhm.
point them in the right direction.
Right,
To say that, I understand if you don't want to talk to me, you can try this.
right.
And that's where the trained professionals are.
And thanks for just sharing those places where people can call. You talked about 988. You talked about your EAP plan and Kids Help. So there are things out there, and people can just go to Chat GPT if they want. Specify the region, because you'll
Yep,
probably get a better answer if you specify your region,
yep,
or even Google, Bing, whatever, because
yep.
those
We
open
have
the doors to possibilities for that kind of help in confidence.
Yeah, and we also have on our website on pixelfoundation.org/get help, we also have the number of those helplines as
Okay,
well.
good
So
for
if you'd
you
like
to
to go in
share.
there. Yes.
For you to share. I think sometimes people don't get it. People don't really appreciate and understand what people are going through because maybe they've never experienced before, and they say, well, why
Mhm.
can't they just find ways of de-stressing? I'm okay. And they don't have that empathy or understanding. Like, how do we help people understand the depth of that people can go to when they have mental health illnesses? People who can't even wake up or get
Mhm.
out of bed, who feel like there's a hole and they're stuck 20 feet and they don't even have a ladder to come out. Can you share some of that feeling, and how we might be able to help those people that don't get it?
I'd say that is a very difficult question to answer.
But
And
I'm going to ask you anyways.
I don't think I have the right answer for that. Um, because somebody I think also who, doesn't think that I don't know if this is the right term to use, but doesn't think that mental illness is real or that you should just suck it up. And you'll be fine in a couple days. Like go to the gym, you'll work out, you'll be fine. Um, you know, that is a lot more difficult
Yeah, yeah,
than somebody who understands, or at least when you see somebody, either your friend or loved one, that can't get out of bed in the morning, who isn't answering their phone and doesn't seem the same way that they used to be. Um, those are two very, very different situations. So I think I don't know that I can give you a good answer for that one.
I know it was a tough question to ask, but I think even asking it makes maybe those people who say, "Yeah, I don't get it. Maybe I should learn a little bit more." And I remember, like, I started my career as a nurse, and now I'm in HR because I still care about people. I'm just doing it
Yeah.
with outside of a hospital setting. And I remember doing my experience in mental health, young 19-year-old person going and hearing about people who can't move. They are so deep in their depression that they're not functioning well. And I suddenly realized, what's the difference between me on this side of the bed and them on that side of the bed? Because we suffer loss. People were having circumstances which were similar to my life circumstances, but I didn't have a reactive depression. I felt okay. And I'm thinking, wow. And it was a powerful lesson for me to understand that it can happen to all of us. And sometimes we don't even know it insidiously. But sometimes having coping mechanisms can help. Sometimes they
Yeah.
don't help. And so it was a powerful, powerful lesson. And that's why I like to help people who are in businesses, people who are in HR, to understand what others are going through. Because if you've not experienced, if you don't have a loved one that has experienced it, you don't really have, you may not have the insight to inquire further to see how you can be um, beneficial and supportive in whatever way. Any last minute thoughts before we end our session?
Yeah, I would say that I think that's also why the storytelling also is so important, is because when you share those stories, they're personal, and the emotional side gets through. So it may be that somebody's in the audience that thinks, well, you should be able to suck it up. But as the person is sharing their story, they're describing how they felt, why they couldn't suck it up. And that might be the catalyst that maybe will change their mind about how mental illness works and how it affects people.
Thank you. Thank
Um,
you for
yeah.
sharing that, Amy. What's next for you? What's
So what's next for me is so we've changed the name of the Henry's Foundation to now the Pixel Foundation. So that was completed in the fall. Going forward, actually, I'm really excited. We've got some programs that I'm looking forward to getting out, and that will really sort of complement, I think, what the foundation is all about, and hopefully be able to help other businesses as well in sharing that information.
I love how your family chose to help others with mental health. And part of your story is because your family has been affected by it and you want to help others. And this is, I'm just, feeling so good about the thought of what you are doing to help. And so thank you very much for coming on today. How do people get a hold of you?
Best way to get a hold of me actually is probably email, and that's Amy, so AMY at pixelfoundation.org.
I love how
Foundation.org.
you named that, because it really relates to cameras and pixels.
Yeah,
and
we wanted to stay true to our roots and why the foundation came, why the foundation evolved and what it really is all about.
yes.
So we want to stay true to that.
Well, a perfect name for it. Pixels, pictures, stories, a
Yes.
thousand words, a picture paints a thousand words. So
Yeah.
thank you very much, Amy, for coming on and sharing your story and sharing why we need to put mental health into focus.
Thank you so much for having me. This has been fantastic. I really enjoyed the conversation.
Thank you. And so did I. Thank you. And to those of you who have our listeners, our viewers, give it a thumbs up if you loved it. And think about subscribing. Push that button to subscribe because I have a host of people who are experts in their field of business and human resources, and they're happy to share their expertise and give you tips and strategies and trends. Thank you, and rev up your business. Thank you for tuning in to Rev Up Your Business with Hilda Gann. Be sure to like, comment, and subscribe to our podcast on YouTube and Spotify to stay up to date with all of our latest episodes. For more HR tips, strategies, and to learn how you can create a people-centric workplace, visit our website at peoplebrightconsulting.com.